Hello, everyone, and welcome, welcome, welcome. My name is Tracy Parris-Benjamin. I am your host for the evening/afternoon, depending on where you're watching us from. But we are so excited. I am truly excited as we wind down the end of the year. It's hard to believe that 2025 is coming to a close. But there are so many exciting things ahead of us. And one of those things specifically is Power in the Pause. This is an opportunity here to talk and to learn more about menopause, premenopause, and get those questions answered and help us as women live more fuller, more healthier lives through this phase of life. You are here in the virtual sister circle. That is an honor and a pleasure for me. One of the things I've been thinking about is making sure that I live more intentionally and making sure that we can improve our lives by answering questions and not being ashamed and not letting stigma dictate who we are and what we do. So we have an exciting, exciting topic to talk about. We have a screening. It's a little snippet giving you some insights. We are going to hear from some special guests. I have the honor and pleasure of meeting our CEO of the Black Women's Health Imperative and President, Joy Calloway. We also are going to be talking to Dr. Mia in a few. There is a survey that we want those of you who are here today to fill out. This survey will help us to be informed, to know what your needs are, so we can address them appropriately and we can share this data. Data is so important. So that is going to be in the chat. You'll have an opportunity to participate and fill out that survey, whether it's throughout this session or after, but we want to make sure you get to it. So without further ado, I would like to introduce our president and CEO, Dr. Joy Calloway. I'm going to take a few minutes to just read a quick snippet of her bio and making sure that everyone knows who she is. So she's the president and CEO of the Black Women's Health Imperative, a transformational leader with more than 30 years of healthcare and nonprofit leader experience. She has guided major organizations through change, led national conversations on mental health and emotional intelligence, and is widely recognized for stabilizing and strengthening institutions during periods of transition. Joy has held executive roles with the National Medical Association, Planned Parenthood of Greater New York, and multiple community organizations. She's a sought-after speaker, mentor, and advocate. And she is most proud of being a mom to her daughter, Vashti. Joy, I'd like to kick it over to you to give us our opening remarks.
Thank you so very much, Tracy. Great job. I am jazzed tonight, y'all. I am jazzed, first and foremost, to be 8 weeks in now at the helm of the Black Women's Health Imperative. We are the only national nonprofit solely focused on facing and dealing with the critical health needs of Black women and girls in this country. I am jazzed to be tonight in this community, both online and in my regular workday, of dedicated and expert public health, healthcare policy, marketing professionals who are also dedicated and passionate about Black women and girls. I'm jazzed because tonight we are amplifying the power in the pause. And that's something I hope we really lean into. There is power in this season of our life, sisters. And I am jazzed because we are unapologetically talking about that which has in the past been shrouded in secrecy and shame. I'm jazzed because our landmark study, the largest cross-sectional study on menopause experiences in Black women 30 years and older, is getting so much press. If you haven't already seen it, please get to our website and check it out. We are so pleased that so many organizations and individuals, entities, and media are reaching out to us to ask us about this study. What did we learn? What are we doing with it? And we're excited that it's getting so much press because it's about time. I almost said something else. It's about doggone time that people start paying attention to Black women's health care, and especially this period of our lives. I am jazzed that at the moment, I'm not having a hot flash, I don't have brain fog, and I'm feeling hydrated. So that's worth celebrating in this moment because I'm in the journey with you. I'm jazzed that tonight you're going to get some snippets of our Power in the Pause events that we are so excited that we are celebrating tonight. And I'm finally jazzed that you are going to hear tonight from a phenom, a physician champion, a sister beloved, and someone who has taken the extra time and effort to become an expert in menopause, especially for Black women. So tonight, if you needed to know, I'm jazzed. Thank you so much for the opportunity to open the show. I can't wait to see what we're going to talk about. I'm interested in learning some more myself and hearing from other sisters. Thank you so much and glad you're here.
Thank you so much, Joy. I think it's so interesting that you choose to use the word jazz because many people are not using that to describe menopause.
No.
And I think there are some exciting parts to this because it is a different journey in our lives. You know, we are taught that, you know, you age and you kind of no longer have the same level of substance. And I think that's so untrue. And I can speak for myself candidly. And hopefully I don't have a flash because it might happen in real
It might
time. So guys, if you see it, it's just a little glazed donut look. It's all good. So many of us have our little fans all around. So listen, if it happens, it happens. And I am just so happy to be here. I just want to take this moment to say this, Joy. Welcome, welcome, welcome to you. I met you in person, but I just want to say welcome. We are so guided by your leadership thus far. Thank you.
Thank you.
So now I'd love to kick it over to Dr. Mia. I am going to take an opportunity to read a few words about Dr. Mia. So Dr. Mia Cowan, affectionately known as Dr. Mia, is the founder and medical director of Me Bella Wellness Center, a nationally recognized board certified gynecologist, best-selling author, podcaster, speaker, who specializes in hormone therapy, wellness, weight management, and intimacy health. She leads a multidisciplinary team committed to the approach and innovative services. She is dedicated to transforming lives and empowering women to embrace their healthiest, most confident selves. So without further ado, Dr. Mia, I'd like to join you, make sure that you join us in stage as we get ready to watch this fantastic video, which is just snippets of Power in the Pause. And then we'll have an opportunity to react and respond and get into some real juicy conversation.
All right. I'm excited to be here. Thank you so much for having me.
You're welcome. You're welcome.
And
how's
more
your day?
Excited to really have this conversation that's well overdue.
Well, I always ask folks how their day is going because I think it's important that we plant ourselves and be grounded. So how is your day going?
It is excellent. It's been a great day.
That's good. That's good. Well, my day's going so far. It's the evening for me right now. What about you?
Yes. It's 5:10 here.
Okay. All right. It's 10 for me. So it is time to kick it over to our screening. We'll give it a few minutes, just make sure it gets all set up and do all the things that it needs to do. And then you and I will have an opportunity to talk a little, dive deep into all the things that are menopause, brain fog, hot flashes, anxiety, depression, managing grief through this transition time, and all of that good stuff.
Awesome. I'm excited. Let's go.
Let's go.
I actually thought I was having a heart attack.
The heart palpitations was enough to jolt me out of my sleep at 2:00 in the morning and think that I was dying.
I think I'm having a heart attack. I think I might die.
Oh, I
Dearly
think we're
beloved,
missing our sound.
We are gathered here today to talk about this thing called midlife.
The hot flashes, the mood swings, the irritability.
Midlife. You know about it.
I actually kept my beard on for this. Facial hair growth is one of those things that is a part of menopause.
Some of you are there, some of you are past it.
I would describe it as your oven going from preheat to 450 degrees in 30 seconds flat.
We've all heard about what happens at that time.
Like I'm having one now. And it's terrible. You want to take off your sweater?
Because you know I'm talking about midlife, right?
I like puberty all over again. My daughter is going through puberty and I'm going through this other part. So
the change.
This doesn't have to be this fearful, scary, taboo thing that so many of us were taught that it was going to be.
It ain't going to be like that.
When we think about women and what's kind of our most vibrant hormones are the hormones that we lose in menopause. And so for me, I always say, why would we wait till our tank is empty to refill it, right? And so when our tank is getting a little bit, that yellow light comes on, even though I have been the one where it's yellow and then there's zero. But typically, you're supposed to wait for the yellow light, and that's when you really should start to think about how can hormones help me now for one, symptoms, but also longevity. Because the goal is, I have some news for everyone, we're all gonna age. We're all gonna age, but that's okay. But if we have the ability to determine how we would like to age and show up later, then that's what hormones can provide for you in a longevity perspective. So I'm glad that you're doing your research. This is why we're here today, to be able to give you the expert advice and have you understand that that stigma really should be taken away about hormone replacement therapy, and it really is actually very, very beneficial.
One thing I want to bring up, I know probably the elephant in the room, and Dr. Jessica and Linda, you can also attest to this. We talked about this in the back. One of the biggest things that people are afraid of is what with hormone therapy? Breast cancer, right? So in the study, we all have a baseline of having a risk of breast cancer. And people who take hormone replacement therapy, that risk is not that much more elevated, barely, than your normal risk. But guess what that risk actually equals with? Diabetes, smoking, and having alcohol 5 to 7 days a week. It's the exact same risk. And obesity. Did I say obesity? So we have to remember, though, those are the same type of risks. So think about that when you consider hormone replacement therapy.
And then for breast cancer, that was kind of like the thing that everyone kind of hung on. But what kills women the most every year? Heart disease. So if you were thinking about your heart and how to be protective of your heart, most women die from heart disease after menopause because why? Their estrogen has declined. So estrogen is actually very protective. And so if you would want something, if you're like, what is the riskiest thing that would kill me? Heart disease. And so if you take all cancers together, breast, ovarian, endometrial, put them together, heart disease will still win. So if you want something that's actually going to give you maybe the best benefit of what would protect me against heart disease, then that start to look at estrogen a little bit differently and protect you.
You know, in light of the side effects and adverse effects of estrogen, I'm thinking of clots, and I'm worried about DVTs and PEs. Now, is that dose dependent? These are things that, of course, we're seeing a lot as well. So could you please enlighten us? Thank you.
Yeah, I think looking at your family history and then also your personal history is really the deciding factor in what you would want to take. And also when you think of the variety of modalities that you can take hormone replacement therapy, estrogen, which is kind of like for women the most that we'll look at, but estrogen, progesterone, and testosterone are all really, when we think of hormone replacement therapy, in that bundle. But estrogen is probably our most prominent hormone. But it's also how you take it. So for example, if you have a history of maybe heart disease or blood pressure, then maybe less oral and more of a patch or a cream or a gel. So that's really, again, that intricate discussion that you should have with your doctor on, can I take it, what's my history, and what modality should I take my estrogen in?
I want to follow up on a comment you made about how we age, and I think that there's a stigma associated with aging. There's a stigma associated with menopause. You know, back in the day, you heard the word menopause is like, she old, no use to society, just gone and get ready to die. And I see aging as a blessing.
Yes.
It is a wonderful opportunity to apply all of your life lessons, to live a fuller, happier, abundant life. And so how can we reframe our perspective, our mindset on aging and live healthy, long lives?
Yeah, I think menopause has been kind of that, if I were to have a screenplay, menopause is that horror story that everyone doesn't want to watch. And so my goal, and even in my book, Generation M, was to change that narrative of rewriting what menopause means. You know, there's a term in the Japanese culture, and they actually term menopause kanenki, and that really means a beautiful transition. And so I think if we are able to, in society, in culture, in how we share stories with women who are younger than us, because a lot of us didn't get stories other than it's horrible from our grandmothers and mothers. So if we can start to change that storytelling, if we can look at what are the modalities that we can get with diet and exercise and improve our longevity and quality of life as we go through this phase, we'll really be able to transition into a beautiful, graceful period of menopause.
So I know know most of us only heard about one symptom. What was that one symptom, everybody? Hot flashes, okay? Hot flashes. I think we started learning about that when we learned about our periods, which is when we really should start talking about all this, though, quite frankly. But what are some of the other symptoms?
Well, there are many symptoms. I will say, when I was in my mid to late 30s, I was actually waiting for the hot flash. Many of us are waiting for the hot flash, right? But a lot of times that may not be the first thing that you see. A lot of times it could be changes in your cycle. I don't like to say heavier or lighter because it could be either one. Then also mental aspects of it, the mood swings. So some of the first symptoms that I saw was actually mood swings and heart palpitations was the first symptoms that I saw. So I actually did not think it was perimenopause because I was waiting for a hot flash. And a lot of times that may not be the first thing that you see. There's several other symptoms as well.
There's a whole list of symptoms, but kind of the ones that I typically hear from my patients are change in sleep. We said hot flashes, irritability, mood changes, changes in skin, vaginal changes as well, drier vagina, decrease in libido, but also energy, just kind of like this subtle shift in energy. And our most favorite one is how our bodies keep fat. We love that one, don't we? Okay, we don't. But there is a very big shift in how our body utilizes our food and how it actually, the decrease in estrogen changes how your fat is stored and it migrates up to this area right here. We're all very familiar with that. But it goes from our butt and our hips and it moves up to our midsection there. So a lot of different changes.
Yeah, so are there some things that we should rule out before we assume that these are perimenopausal symptoms?
Yeah, that's actually a very important question. I was on a panel discussion yesterday, and one of the things that we hear is sometimes now you see the flip side of anything that happens to you. You're like, oh, I'm perimenopausal or menopausal. And so I do think that there is kind of a ebb and flow between how we need to find exactly what it is, and that's the process of elimination. But that is, again, another lifestyle factor of when you start to have these changes happen, is saying, what's going on in your life? What are some things that we could tweak that could offset some of these symptoms? And it doesn't always necessarily have to equate to, I have to be on hormones or I have to take a medication, but there can be other things such as thyroid that starts to happen. And also our bodies, just with the aging process alone and decrease in estrogen, you start to become more insulin resistant, which means your body starts to tend to want to be more diabetic. And so those are changes that can occur as well. So being on the preventative side of what are these changes that are occurring and what can I do in my daily habits with lifestyle, eating, and exercise to offset, but also what are some things that I can look for that may not be directly related to a perimenopause, menopause aspect.
Can you speak to things like endocrine disruptors and things that literally can take hold and make your experience with perimenopause and menopause worse because we're not mindful of the things that we're ingesting, things that we're exposing our skin to, the environments that we're in, and the like?
Everyone in here has an opportunity to take things out of their daily life that are not helpful for them. And so when we think of hormone disruptors, those are things that are going to be in your everyday use, whether it's with the things that you use to wash your face, your makeup, plastic when you warm up plastic and eat in that. And all of these different things that are in our food that disrupt hormones are, again, going to take the hormones that are, or the disruptors rather, that are in these things and change how your actual natural hormones are going to start to deliver those messages as chemical messengers. So again, that's another thing that we see through foods. A lot of processed foods are going to have things that are not ideal for you. So I would say, and I don't, I'm going to come back with you on a website that would be very helpful for looking at hormone disruptors specifically. But there are so many things that if you were to look at your everyday life, you're like, oh my gosh, if I took this and this and this out, this may be actually helpful for my experience as I go through perimenopause and menopause. So thank you for bringing that up, because again, those are the things that are our responsibility to do every day to make our experience as we go through perimenopause, menopause, and aging better.
Nutrition is so important. Yes. We were talking about it on the previous panel. There are some things you can do lifestyle-wise as it relates to menopause, to make it more manageable, to thrive in that space as well. So really excited about having this conversation. Sharon, I want to go ahead and get started with you. As a nutrition expert, where should we be in terms of our eating habits and our nutrition as we go into perimenopause and start experiencing those symptoms in menopause as well?
Absolutely. You know, what's so interesting about this conversation, I was having this conversation with a group of people last week about menopause and nutrition, and I was making a point, I don't think I had problems with this before. But once I thought about it, I realized that I myself, even the nutrition expert, had some issues to deal with it as it related to menopause. One of the biggest things I want you guys to consider here is what happens when your estrogen level starts to drop. And because of the drop, your metabolism slows down. As was said earlier, you're more prone to insulin resistance, which is that start to diabetes. There's so many different things that are going on. So what we need to do is concentrate on being really intentional about how we eat. We can't get away with what we used to be able to do. You're right? When I go back 10 years ago, the things I could eat, I can't do it now. So what the focus should be on is what you see up here. We talk about eating more fruits, vegetables, whole grains, beans, nuts. You need to eat as close to the ground as possible, right? When I say eating close to the ground, close to how God made it, that's how we want it. Apple, applesauce, apple juice, apple pie. Which one's better for you? It doesn't get as simple as that, right?
Wait, I can't eat the apple pie?
So start there, eating closer to the ground, eating more natural.
Absolutely. And Dr. Stephanie, I want to ask you a question, specifically as it relates to nutrition. Well, really, not necessarily nutrition, but something that I think plays a huge role with women in weight gain going into menopause, and that's sleep. The role of getting rest. Because I think that that's a really big deal. I know some women who celebrate getting 6 hours of sleep. They think that's a big deal. So what is your insight on that?
Well, for me, I do now sleep. When you said 6 hours, I probably got 6 hours last night, to be honest. So sometimes 6 hours can sound good, but it's important for us to rest because your body has to build itself back up overnight. You want to make sure that you're resting. But for me personally, magnesium has been very important as far as helping me get sleep. So at nighttime, if you are having issues, personally, magnesium oil is what I like to take. But for other things you can do as far as your diet, and also, do you have a healthy sleep routine? What are you doing before you go to sleep? When are you stop drinking caffeine? Do you even drink caffeine? So things like that. Look at your diet and see what types of things you're eating. Personally, for me, I like to write down what I eat. So for me, a trigger for a hot flash is alcohol. So if I know I'm gonna have a glass of wine that night, 9 times out of 10, I'm probably gonna wake up in the middle of the night with a night sweat, which interrupts my sleep. Then therefore, I'm gonna be off the next day with brain fog because I was sleepy and didn't get enough sleep. So it's important to see what types of things you're eating, and then also if you need to supplement with things like magnesium, that can also help you get your rest as well.
So here's the thing you need to know about caffeine and the whole thing about magnesium and how soon before bed. One of the biggest things is, what is the body doing in the middle of the night for you? It's keeping you well. There are things, that's the body's me time. So if you eat too close to bedtime within that 2 to 3 hours, the body now has to digest food instead of doing those things it needs to do to keep you well. So I tell my patients 2 hours to the minimum, nothing but water. It's not a snack, nothing but water, 2 hours before to give that gut time to settle in for the night, right? So that's the biggest thing about sleep. Going back to the caffeine, the point was made about that. Caffeine has a 6 to 8 hour half-life. In layman's terms, in your system 6 hours, but it's actually there up to 12 hours. So if you take in caffeine after, say, noon or 2 o'clock, you ain't sleeping. 80% of people are caffeine sensitive. You know, they are stimulated by caffeine. I have a sister who can drink caffeine before bed. It doesn't bother her, but that's not the majority of us. And so you think that it's okay to have it later in the afternoon, it's gonna get you. You're not gonna be able to sleep. So as we were saying, You're thinking that the problem is menopause itself, but it really is the caffeine. And don't just think about coffee. We're talking about tea, we're talking about chocolate, we're talking about Cokes, all of that. That's where it's coming from.
Erin, I have a question for you. I think one of the most challenging things for many women to determine, well, really probably not challenging, but we're in denial, the difference between being hungry and having a craving, right? I'm hungry, but I gotta eat fried chicken, you know? So what are some things that we can do to tell the difference between hunger and craving, and how can we fight off those cravings, specifically sugar cravings?
Yeah, well, the bad thing about sugar is that once you start eating it, you want more. And so if you keep eating that sugar, you're gonna keep craving the sugar. So really, one thing that helps me, and one thing that I teach the participants in our program is that, you know, sometimes you're kind of thirsty and you think you're hungry. And so take that, if you're having a really bad craving and you think you want this sweet thing, drink some water and then wait about 15 minutes and then see if you still want that sweet thing. And a lot of times that craving can go away. But like I said, if you start off eating that sugar, it's just a roller coaster because it's doing things to your blood sugar, it's going up and down, and as soon as your blood sugar crashes, you want that sugar again. So it really is important to pay attention to that and how you're eating. And then when you're eating through the day, you know, it typically takes our bodies maybe 3 to 4 hours to digest the food. So typically that's when you're gonna start feeling hungry again because your body is saying, okay, we've emptied out everything, we've extracted all those nutrients, it's time for us to get some more in our system. So kind of thinking of that, so if you just ate and it's 2 hours and you're feeling like you need some more food, like you're ravishing, it's probably because you either had way too much sugar initially in that meal, or you might just be thirsty. But we always have to think about hydration. Always think about that water, because if you're not getting that water, your body just starts craving a lot of other things.
So well said, Erin. If I can add to that, which is so wonderful, this is one of the biggest questions I get about cravings when people walk into my office. I had a patient a couple weeks ago said, I don't know how you're gonna help me, I have horrible cravings. I said, I can fix that today. She started laughing. I said, no, I'm serious, right? So y'all wanna know what it is, right? There's powerful research that suggests that sugar has addictive properties on the level of crack cocaine. You know that, right?
Oh, absolutely.
So the reason you're struggling so much is because once you get addicted to it, it's hard to give it up. But research also has revealed to us, even when someone's on an illicit drug, that they only need, let's say crack cocaine, right? So they actually only need about 3 hits to be at maximum pleasure. So the question was asked, does the same thing work with food? Absolutely. After about 3 bites of that sweet thing, you at maximum pleasure. You just keep eating because what? It's good and it's there. So let me give you 2 ways to cut your sugar cravings in half overnight. 2 things you promise yourself. Never ever eat sweets on an empty stomach. If you do, it's gonna spike the blood sugar, as Erin was saying, and you're gonna drop. And when it drops within 45 minutes to an hour, what do you want?
More sugar.
More of that. You ever had one of those days you can't stop eating? That's what's happening. The second rule is only eat after the meal, because we're hoping what's in the meal we're going to talk about in a little bit is fiber. And fiber is that miracle substance that changes the game. So if fiber's in that meal, it's going to coat the layer of that stomach, so when the sugar comes, it slows it down. And then if you're not hungry, the other part of that, you can limit yourself at 3 bites. Try it. You're going to be surprised it actually works.
All right, we're getting ready to get to the hot and steamy part of this program.
We don't often talk about what happens to our libido, other aspects of our sexual health, including other aspects of intimacy, painful intercourse, all those things that happen during menopause and after.
I would say definitely start with understanding what's going on with your body. As Dr. Shepard said, when you're decreasing your estrogen, so many things change. We've already talked about our muscle mass and how that changes. Our pelvic floor changes as well. We can be experiencing things like prolapse or incontinence. Vaginal dryness obviously is a big one that directly impacts intimacy. your partner does not necessarily understand that you're going through those changes. So in understanding it yourself, you can better communicate to them, whomever it may be, what's happening. They can grow a little bit of maybe empathy in that for you, and they can also engage in a conversation of what might feel good to you, what might work better for you, what lubricant we might need to try, right? We need to focus more on the foreplay instead of the actual intercourse portion. Because those type of discussions, very healthy discussions, are necessary to be able to pull more of the intimacy in.
Can I add
That's
something to that?
Perfectly back to the question that was asked earlier about the vaginal estrogen. So can we get that? Can we talk about that a little bit?
Yeah. Right before we get there, can I add to that there is a I specialize in couple therapy, right? So this shows up a lot, and it doesn't help our partners to not talk to them and not educate them about what is going on, right? This is more specifically if you have a cisgendered male partner, right? And I don't know who we're talking to in the room, so I want to keep it very open in terms of identity. But something that Black women oftentimes struggle with is vulnerability, right? And being honest about what is going on, whether we know what's going on or not. I might not know that this is about perimenopause or menopause, but I do know that something doesn't feel good down there, right? And when we hold ourselves responsible, right, for the other person's pleasure, right, it can bring in a lot of shame, right? So I also want to make a note that you are not solely responsible for your partner's pleasure. They are responsible for their pleasure and their bodies, and you are responsible for yours, and you meet in the middle of that, right? But oftentimes women have been socialized sexually to believe that I'm responsible for everything you're supposed to experience.
That's a mic
right?
drop.
You are responsible for your pleasure, and sometimes if you can't get that from me, you need to get it from yourself. I ain't say somewhere else, I said yourself, right? So I really want to be clear about that, because a lot of that responsibility that is placed historically on women and femme people is really unfair and really imbalanced, and is not possible for you to be the sole responsibility for your partner's pleasure.
Wow. Perfect.
I would say in my own personal life and also in my practice, because we really do focus on mind-body connection. Mind-body connection is, I would say, three things. Is set boundaries for yourself, really learning how to set boundaries for yourself. And that's a little bit of what you were saying, don't feel free to call me, or, set true boundaries for yourself. And again, it's not easy, but once you practice it, it then becomes easier for you to do. The other thing that I would say is all of us have endured some form of trauma. And when I say trauma, it doesn't have to be some monumental thing that's happened to us, but some trauma really can reflect later on in life how we show up for ourselves. So taking the time to maybe dig down to figure out what exactly that was, how it's not serving you, and how you can start the recovery process from that. And it can show up in so many different ways in your life, but really taking time to honor that. And the last thing that I would say is, because this is probably my favorite thing for all across your life, is movement and exercise. Body work, just really your body and what it can do for you, you have to honor it back and you have to invest in it. And so when we talk about disease prevention, when we talk about going through menopause, when we talk about sexuality, all of these things, your body is what carries you through those moments. So honor your body with exercise and movement. Even if it's a walk, 20 minutes a day, start there. Every day start and find a different way to move your body.
As a healthcare provider, I would say that the one thing I want to make sure I emphasize for this group of women is that you don't have to know everything about this change that your body may be going through, or even what to expect in the coming years. And you should be able to feel like you have solace and a place that you can go and discuss what has been going on and be able to be given real options. So I believe in second opinions. There's absolutely no tolerance for gaslighting or deciding for a patient what's best for them and not engaging them in the process of what their options are. And this is unfamiliar territory. We don't talk about it enough. We haven't necessarily gotten the lineage of it enough. We've said that a million times today. So if you're not able to engage with your healthcare provider, find another one.
I want to thank Estellas. Estellas is our sponsor.
Hi. That was so engaging and interesting. I found myself kind of really getting in there, almost forgetting that I have to come back to this, not because of you, but just so much good nuggets, so much good information, Dr. Mia. You know, I've attended one Power and a Pause that was here in New Jersey, and I have to say each one seems more and more elaborate in terms of just the knowledge. There's so much to learn. So you attend one, it's not just one. And I think that's the journey for women through menopause, is just continuing to learn more and more and more. So many good nuggets. I'm just wondering what stood out for you as you watched, the few minutes of a Power and a Pause. What really kind of resonated with you, or moments that you were like, wow, I'm glad that was said?
Well, I guess for one, and you hear me fine, right?
Yeah.
Okay. So I think for one, I think the biggest thing was that you're not responsible for your partner's pleasure, but you are responsible for your own. So, making sure to notice those changes that are going on with your body. And then I think the other thing is that we're even talking about perimenopause. That is a new conversation. It's something I've been talking about for a long time at my practice because I specialize in hormone therapy, but it's something that a lot of women don't know about. And even other physicians. So a lot of my patients that come in their 30s and they're having night sweats and they're not sleeping and they're tired all the time and they have a decrease in libido, they go to other doctors and their doctors tell them that they're not in menopause, so they're fine. It's just normal. And they start giving them all of these pills for the symptoms versus actually treating the cause. So I like to practice root cause medicine, and I'm very excited that we're having these conversations that go along with root cause medicine so we can truly fix the problem and not end up on a lot of medications that are just only treating symptoms and not the real problem.
Yeah. And I think going back to being responsible, I think that's just in totality, responsible and being the CEO of your own health. So, how do you start to actually identify these symptoms? Because I know I have quite a few friends, and we're starting to blame everything on menopause, right? It's like, oh, it's the menopause, it's the menopause. But I think it's the monitoring. And that really stood out to me, even with the diet, just being mindful of the diet, the foods, processed foods, when to eat. So I was wondering if you would, wanted to chime in on that a little bit based on your experience. Have you seen women who talk about a particular diet that either works or supports them? Or, if you just had any additional thoughts that you wanted to add to those particular comments?
Well, I think understanding that the difference in menopause and perimenopause. So perimenopause starts anywhere from 10 to 15 years before actual menopause. Menopause is usually around 52 for the average woman, but you can always check with your mom and see when she went through menopause, because you tend to start your cycle around the same time your mom did, and you tend to go into menopause around the same time your mom did. But perimenopause actually starts when you still are producing estrogen. You're just no longer producing a lot of testosterone. And I call testosterone the forgotten female hormone, and it is the cause of perimenopause, a decrease in testosterone as well as progesterone. Estrogen is more so of the menopausal, when your cycle stop, and we consider you 1 year post-menopausal, your ovaries are completely done, not producing progesterone, not producing estrogen, not producing testosterone. So I think that understanding that that perimenopausal symptoms can start as early as your early 30s, sometimes even in your 20s, especially if you're on hormonal birth control. Hormonal birth control naturally decreases your testosterone levels. And when your testosterone levels start to decrease, that's when women first start to notice, very sometimes gradually, a change in sleep. The night sweats, sometimes they just start coming every now and then. Sometimes women just notice it around their cycles. Sometimes women start to notice it every single night. Then they start to notice a decrease in desire for intercourse. And it's, again, very gradual. So you just look up one day and you're like, oh my God, I haven't had sex in like 3 months, Then you start to notice that you have to work much harder to have an orgasm, which is very frustrating. Testosterone or the lack thereof decreases your enjoyment of intercourse as well as your desire. Then you start to notice that you're just tired all the time. You wake up tired, you go to bed tired, you're tired in the middle of the day, you need a nap in the middle of the day, you're not doing your social activities anymore because you're just too tired. Then you start to notice the irritability, and if you already have mental health disease or challenges, then it worsens. Even if you're taking your medications, you're doing all the same things. When you start hitting that perimenopausal state, if you have bipolar disorder or schizophrenia, you've been fine on your medications, but all of a sudden your medications aren't working anymore. You're having more irritability, more depression, more anxiety, worsening of your mental health disease. Then the focus and the memory. So all of these people who feel like they're getting adult ADD, all of a sudden you never had problems with focusing and remembering, but now you have adult ADD, which is really low T. And then the belly fat, like that starts in perimenopause before you start losing estrogen. Actually, when your testosterone starts to decline, that's one of the first signs for men and women is that you start getting more belly fat. So, and that's a sign that your lower testosterone is starting to increase your insulin resistance. A sign of belly fat is showing that you have insulin resistance. And then the joint pain, all of a sudden, you have joint pain in your hands. You have it. A lot of people start noticing it in their knees, especially, and that frozen shoulder thing, which usually tends to start closer to menopause, not as early as perimenopause. That's when I noticed it, and that's when a lot of my patients notice it. But I think understanding that many of these symptoms that we consider normal aging are really not normal aging, is normal low T. And so replacing the testosterone will actually treat these symptoms so that women can age better and feel better.
Yeah, it's fascinating to me because as you talk about perimenopause, which isn't often talked about as much, and I'm glad that it is, it's usually at the time where women are probably at the height of their careers, on or about, or maybe they are also caring for, loved ones, or they're caring for a child. And maybe if they have a job that requires a lot of them, they're feeling that all of these things are just a part of the basic life, that I'm going through, life issues. So I do think it's important that we talk about this, like those changes you mentioned with medication, if you have mental health issues, because I think that needs to be more and more discussed. What would you recommend that women do as they're starting to notice these changes? Like, how do they have that conversation with their doctor, whether it be their PCP or their GYN?
So I would recommend a gynecologist. So I would say first talk to your gynecologist. Mention to them that you're having these symptoms. Let them know that you would like to have your labs checked because you feel like you're having a lot of the symptoms that people associate with perimenopause. You need to stay with your gynecologist if they check your labs and they start to treat your symptoms with hormone replacement therapy. So for many people, if you have the option and you can see a gynecologist who actually has special training in hormone therapy, or you can see a hormonal specialist that may not necessarily be a gynecologist, that is what I recommend for this time in life, because the average gynecologist is not going to treat testosterone, low testosterone. The average gynecologist was trained probably, a few years ago before we learned that estrogen, before we shared with the world that estrogen does not cause breast cancer. You know what I mean? So a lot of times if you go to a gynecologist who does not specialize in hormone therapy, they may not give you the right information and they may not be open to treating low testosterone. So finding a hormone specialist and or a gynecologist, I would say would be my starter point, outside of a family practice doctor who actually does specialize in menopause and perimenopause and hormone therapy in general.
Okay, no, that's really insightful, because I know for a fact, I can speak again for myself personally. I think it's important we share stories. You sometimes have to bring it up, with your gynecologist, because the thought is, if you're doing fine and, you're playing good patient, which so many of us do, right? We go to the doctor and we're like, I don't have any of the symptoms now. I feel fine. It always is when you're in the doctor's office and you forget. So I always say to my friends to really create a journal, to write down what those things are. And again, kind of tying it back to the video, that thought about, monitoring when you eat certain foods. I know for me, I stopped drinking wine because it does bring on flashes. Doesn't mean you have to not have it all together, but you make decisions for yourself because then you know that night is going to be, a challenging night.
Yes.
I do want to move into a little bit about, thinking about professional and personal experience. So, what do you see in your practice, or even if it's for your sense, personally, when you are going through those changes? What are some of the symptoms when you're actually in menopause, outside of hot flashes as well?
Okay. So the night sweats, the problems with sleep, the increased facial hair and acne, the thinning of the hair, the joint pain, the belly fat, the weight gain, just like all of a sudden weight gain. I think in perimenopause, you start to know, when you first hit perimenopause, you start to notice a little bit more weight in your abdomen. You notice that it's a little bit harder to lose weight. But when you hit menopause, my difference, I hit menopause this year in March. I turned 50 in August. I hit menopause at 49. The way I knew I was in menopause, because of course I do all of the hormone replacement therapy. The way I knew I was in menopause is I gained 15 pounds, and I could not explain why. I didn't change my diet. I didn't change my exercise. I didn't change anything. Didn't start a new medication. But I just gained 15 pounds and I could not get it off. And, I was like, you know what? And my shoulders started hurting. I was like, you know what? I think I'm in menopause. So I checked my labs and I looked, and my FSH had started to increase, which is the follicle stimulating hormone. My estrogen levels had completely declined. It was a little bit harder for me because I was always on birth control. So that's what made me stop birth control and check my levels, because when you're on birth control, it does suppress your FSH. And FSH is that number that you look at to see if you're in the transition phase to menopause. When that number goes over 30 and continues to increase, you're transitioning into menopause. But we all know that the true definition of being menopausal is that you've gone a whole year without a cycle. If you don't have a uterus still, or you had an ablation, so you stopped bleeding well before that, then you look at that blood work, the follicle stimulating hormone, the FSH. And if you see that starting to increase, especially over 30, 40, you know that you're in that transition phase. And then once you're not producing any more estrogen, if you don't have a uterus anymore and your FSH continues to go up and you have all the symptoms, you can consider yourself menopausal. If you're still having cycles, once you go a whole year without a cycle, you're considered postmenopausal, but you can still be having the symptoms of perimenopause, whether you're having cycles or not.
Yeah. No, that's really helpful. Thank you for that. And I think it's important that women do understand, especially if they don't have a uterus or have an ablation, as you mentioned, what lab to request. I mean, a physician should be doing that, but it's sometimes you have to be that advocate. You have to be that CEO. So I want to change the topic just a little bit, still around menopause, but talking about intimacy and sexual health. I know that's a very strong area that you're in. And I'm just wondering, in terms of the responsibility of pleasuring yourself, as that was talked about, right? Like being responsible. How can we make sure that women understand and feel comfortable having those conversations, whether it's with their girlfriends or even with their physician? Because women shouldn't have to live it at a time feeling so, insecure about sexuality during this time as well.
So for one, what I tell my patients is, once you turn 40, you should be treating your vaginal tissue the same way you do your face. So, when I turned about 35, that's when I started going to the dermatologist all the time. I was using my hyaluronic acid. I was using my retinol and anything I could do to prevent the aging of my face. You have to do that same thing with your vaginal tissue, because as your estrogen and testosterone start to decline, that estrogen in the vaginal tissue starts to decline. And what happens is you start noticing more dryness. You may start noticing that you need a lubricant during intercourse. You may start noticing that you're urinating with laughing, jumping, sneezing, coughing more. You may notice that you have a little bit more urgency, like gotta go, can barely make it. You may notice that you're going to the bathroom more frequently. So those are signs that you need to treat your vaginal tissue. But my goal for my patients is to start treating the tissue before it's a problem. So there are some over-the-counter remedies that you can use without even a prescription. And one is a hyaluronic acid, which is something that you can get over the counter. You can put in vaginally twice a week, and that will prevent the normal aging signs and symptoms associated with the aging vagina. So I think the bottom line is you have to treat your vaginal tissue the same way you do your face. As you age, you have to do some extra things. So for one, treating it with either a vaginal hyaluronic acid that you can get over the counter, or discussing it with your physician and getting a vaginal estrogen that you can deposit twice a week at night right before bedtime, or getting a vaginal DHEA, which is also a prescription medication, which you can put in every night or 3 to 4 times a week, and that will help increase the lubrication of the tissue, the sensitivity of the tissue. It'll even keep the color the same. When you're young and you're healthy, your vaginal tissue is pink and it's fluffy and it's lubricated. It always has some kind of lubrication. As you get older, that turns into a pale pink, almost to a white. It becomes very thin, easy to tear, very dry. And then you start noticing all those other urinary symptoms, because a lot of people don't associate the urinary symptoms with vaginal tissue, but it starts with the vaginal tissue. When that starts to change, then after that is going to come the problems associated with urination, like the leakage of urine, coughing, sneezing, jumping, laughing, or the urge incontinence.
Wow. So that is even related to UTIs?
Yes, and UTIs, definitely. So all of these older women, your grandparents and your parents that you're taking care of, and they go into the hospital and they're super sick because of a urinary tract infection, the way we could have prevented that many times is treating that vaginal tissue prophylactically before there's a problem, always making that a part of your regimen. Just like you make that hyaluronic acid a part of your facial regimen, you should always be treating that vaginal tissue, especially over the age of 40, at least twice a week at night, right before bedtime, so that you can maintain healthy, orgasmic, sensitive tissue.
Yeah. I mean, I'm glad we're talking about this, because I know culturally for a lot of women, Black women in particular, talking about it, it's considered taboo. And again, I'm talking very generally, not for everyone, but it's considered taboo, or even to say the word vagina, right? So I think it's really about empowerment. And this is the first I'm actually hearing about all of the things related to caring before. Most of what we're hearing is, oh, when these symptoms happen, there are lubricants and things like that you can use. But the way that you've broke it down in terms of taking care of our face, we'll invest all these products, hyaluronic acid, facials, peels, but actually thinking about how do you take care of yourself in that way is just really, really interesting.
And with age, even with treatment, you're still going to notice differences. So there are some wonderful intimacy procedures out there to help those women who still have symptoms, even when they're doing all of the preventive kind of things like treating the vaginal tissue. There's something called vaginal rejuvenation now that allows us to increase the lubrication, the sensitivity. One of the things that a lot of women may notice is that as they age and mature, with the dryness comes along with this feeling of laxity of the tissue. So things don't feel as tight as they used to be. You can't control your muscles as much as you used to be able to, but treating the vaginal tissue may help. However, you may get to the point where only treating the vaginal tissue is not enough. So vaginal rejuvenation, as well as the O-shot, is an amazing option for women. And that's where we take the platelet-rich plasma, we spin it, and we take all the good stuff, the good growth factors out of your own blood. And then we can put that into your clitoris to help with clitoral orgasms. And we can also put that into your vaginal tissue, into your G-spot to help with vaginal orgasms. So, those procedures are amazing. There's also a device you can use at home, a medical device that you can use every other night to help rebuild the tissue, to help with the sensitivity, to help with the orgasms, to help with the urinary symptoms, and to help with the lubrication.
Yeah. Wow.
So,
No,
so
that's
great
really
intimacy options for women now, and I'm excited about that. There have always been intimacy options for men to be able to enjoy intimacy forever, but now I'm very excited that now that women are in medicine, we have focused in on vaginal health for women and great intimacy and the importance of orgasms, and understanding that wellness includes orgasms. Women who have regular orgasms and regular intimacy, whether with a partner or without, live about 5 years longer than women who don't.
Wow. Is that a
So
fact?
yeah, that is a fact. That is a researched fact.
Yeah, I think that's a fact that needs to be circulated,
Yes.
making sure that people actually know that. Because when we think about health, it's a lot of times it's related to diet and exercise, but we don't really talk about sexual health.
That's
So
right.
it's really important. Thank you for that. I have so many other questions, and I want to make sure that I do leave time for Q&A from the audience. But I do just want to move a little bit to kind of, emotional wellness during menopause. And that is such a huge component. Again, I think it's so important that we share stories, and I'll just be brief. I recently lost my mom, and it's been very, very traumatic. And one of the things that was mentioned is that we all have a form of trauma. And I think when we're going through traumatic experiences coupled with menopause, it can really make us feel like we're just losing our minds. I mean, losing someone that close to you in itself is, as you can imagine, is very challenging. But I do want to talk a little bit about, how do you just kind of navigate the stressors, whether it's grief, whether it's the change of a job, whether it's now becoming a caregiver to a parent while you're going through menopause. What do you say to some of your patients or clients who are dealing with trauma and menopause and just life in general?
Great question. So first, therapy. I think everybody needs therapy. If you're walking around on the planet Earth, especially if you live in America, especially if you are a Black woman in America, you need therapy, and you need to find a good therapist that can relate to you, can relate to what's going on in your life. So many times those people may look like you because they can relate a little bit more. It's kind of hard to relate to the plight of a Black woman if you're not a Black woman because you don't have those same experiences. So I think therapy is huge. I think exercise is key. Exercise decreases anxiety. Exercise decreases depression. Exercise helps with focus. So I think exercise, therapy. I think eating the right foods. I think a lot of processed foods and a lot of fast foods and a lot of sugar, a lot of foods with all the hormones and the steroids and everything that they put in our food in America. I think that plays a huge role in your overall health as well as your mental health. So I think watching what you're putting in your body makes a huge difference. And then I think paying attention to the medications that you take, like what you're putting in your body outside of just food, because many medications can have the side effect of affecting your mood negatively. So exercise, therapy, monitoring what you eat, therapy, exercise.
And therapy.
And therapy.
And, just talking about exercise, monitoring what you eat, but medications, could you just talk a little bit about HRT? If you can just kind of go back into that. I know we saw it on the video, but I do think it's important that people hear a lot, especially now with the black box and, being removed, and people can now disassociate breast cancer with hormone therapy. So can you just chime in on that just a little bit for our listeners?
Yes. So different kinds of hormone replacement therapy. My favorite is plant-based bioidentical hormone therapy, which basically means it's hormone therapy made from a plant, and bioidentical means it looks just like the hormones your ovaries produced when you were younger. They're just not producing as much, so we can replace it with the plant-based bioidentical hormone therapy. That comes in a pellet form, which is the form that has shown to decrease your risk of heart disease, breast cancer, bone loss, and dementia. But it also comes in a cream form that you actually apply twice a day, at certain times of the day. A little bit harder to control, a little bit harder for some people to be compliant with, but still plant-based bioidentical hormone therapy is my favorite. And because that includes estrogen for those women who can take estrogen, women who have a history of a blood clot, or to me, any form of breast cancer should not be taking estrogen. If somebody has a history of breast cancer, they should not be taking estrogen or progesterone. However, testosterone, plant-based bioidentical testosterone therapy can be taken by anyone. There is no contraindication. The main thing is to see a specialist who knows how to manage it, how to monitor the levels, monitor the symptoms and negative side effects that may be associated with it so that it's dosed appropriately. And if it's dosed appropriately, then you're going to receive all those benefits. And the testosterone therapy is what actually improves sex drive, improves orgasms, helps you to sleep all night. I sleep 7 to 8 hours at night as long as I go to bed on time. That decreases the night sweats. Testosterone is the hormone replacement therapy that actually decreases night sweats. And it's two kinds of testosterone. It's synthetic, that you may know from your husbands or the men in your life taking those testosterone shots. That is synthetic. The gel that they rub on, that is synthetic. But the testosterone that's plant-based bioidentical would be the hormone pellets or the hormone creams. And men can't take the creams. So that is hormone replacement therapy. Estrogen helps more so with hot flashes during the day. It helps with hair and skin. The skin starts to thin, the hair starts to thin when your estrogen levels start to go down. The vaginal dryness, estrogen definitely helps with vaginal dryness. And for some women, they just feel a little bit more balanced, and it may help a little bit with mood as well. But testosterone is the one that really fixes most of the symptoms associated with menopause, including the fatigue, the joint pain, the belly fat, the mood changes, and the mind fog, as well as the sleep, the sex drive, the enjoyment of intercourse, as well as the night sweats. But estrogen is more of the hot flashes during the daytime. Testosterone is night sweats. When you're asleep, you are waking up with a wet bed, wet clothes, or you are freezing everybody out in the house at night because you are so hot. So I am a huge proponent of plant-based bioidentical hormone therapy. It actually, the pellets were some of the plant-based bioidentical hormone therapy was the first hormone therapy in the United States of America. It's been around since the 1930s, so it's not new. However, it is not FDA approved. And to me, FDA approval does not mean that it's a good drug. And if it's not FDA approved, doesn't mean it's a bad drug. It means it's not FDA approved. So I will say that the synthetic hormone therapy is FDA approved, but plant-based bioidentical hormone therapy is not FDA approved, though the studies show that it's safer and more effective when used appropriately and dosed correctly.
Yeah. So really, what I'm hearing from you, it really, really matters that women have good conversations with their GYNs about this. And if it's not one who's willing to talk about options, then maybe that's not the right person because, whether it is, FDA approved or if it's not, or if it's, estrogen or testosterone, like you want to have an engaging conversation with your physician who provides you with some options, because I know for so many, they automatically believe that HRT is just not for them.
Right.
Yeah.
Exactly.
Thank you. So I do want to talk a little bit about myths and, things that people have heard, when they growing up about menopause. What are some of the common myths that you hear or things that people just believe that's going to happen to them when they're going through menopause, which is often not true?
I don't know about myths with going through menopause, but I think the myths associated with the hormone replacement therapy, when I was in medical school and residency, we were still of the thought, because I graduated in 2002 from medical school. So that's when that big study came out that we studied, the Women's Health Initiative study, that kind of scared everybody away from hormone therapy. So I think the biggest myth is that estrogen causes breast cancer. It does not. It did not in that study in the early 2000s. That study showed that the women who took estrogen did not have an increased risk of breast cancer. It was actually the women who took the estrogen and the progestin. So it was the synthetic form of progesterone that slightly increased the risk of breast cancer. However, in that study, the old study with the synthetic hormones, it still showed that estrogen decreased the risk of heart disease. And I like that they pointed that out in the video we previously watched, is that everybody is so concerned about breast cancer when the number one killer by far is heart disease. So taking medications that actually protect your heart, which includes hormone therapy, is very beneficial to your overall health. Also, understanding too that estrogen protects the bones. So that's a big deal as you age and mature and you go through menopause, your bones naturally start to thin. So replacement of the hormones can actually reverse osteoporosis and osteopenia when you're replacing your estrogen, your testosterone, and even your progesterone. All three of those hormones are going to help with your bone density and your bone mass. And then, so I think those are some of the major myths. And then that, hormones are just bad and plant-based hormones are bad. All of those are myths. We know that women and men who take hormone therapy have better hearts, better bones. They have a decreased risk of dementia. And for men, it decreases the risk of prostate cancer when you're talking about plant-based bioidentical testosterone. And for women, plant-based bioidentical hormone therapy with the pellets has shown to decrease the risk of breast cancer and breast cancer recurrence. So it is the only hormone for women who have a history of breast cancer that they can safely take the plant-based bioidentical testosterone pellet, and it decreases the risk of recurrence.
It's amazing to know how much work these hormones are doing for us, right? We just, they're there. It allows us, estrogen is like this powerhouse, allows us to multitask and to do all these things and protect our bones and all of that. So that's just very, very enlightening information. I do want to switch gears just a little bit and just talk a little bit about the importance of sisterhood and community. Even that's one of the things that is just so empowering to me about the Black Women's Health Imperative is giving women a voice, having candid, comfortable conversations in this virtual sister circle. So how important do you think that is for women to just convene or come together and talk about this, to be able to ask those questions?
I think it's very important. I think it's imperative. I think it's imperative. I think that the community is great. And I think not just for women your age going through, but even for younger women, so we can prepare them and we can help them make good life decisions in their early 30s before these symptoms are affecting them, so that they can create the right lifestyle, so that they improve their experience through the different stages of life, compared to women who, 10 or 15 years ago were afraid to take hormones. Now we know that there are certain things we can do, like maintaining a healthy weight, making sure we're eating plenty of protein, make sure we're exercising and doing real resistance training, with Pilates or yoga or calisthenics or weight bearing exercise, because that is so important to help with your testosterone levels as well as your bone mass. So did that answer your question?
Yes, it did. No, it did. And I would just add, for myself, one of the things that my sister girlfriend group has done is just all kind of start talking really openly about our symptoms.
Yeah.
And not being afraid. I think for many Black women, there's just this thought that, we're strong and we can manage things, and, you're tough and you can go through it and you can fight through it. And I do think it requires a level of vulnerability to be able to start to talk about, I don't feel well, or I don't have the energy, or I'm really tired. And that goes into the mental health component.
That's right.
So I do want to just take a moment to just highlight the fact that so many of us are so embarrassed to talk about the need for mental health support. And I think coupled with menopause, it creates an open door. It creates an open door to allow for people to start to really kind of brace that question around, am I going crazy, or am I actually in menopause, or is it a combination of both? I'd like to take this opportunity to open the chat for questions. I know that we have folks that are online and they're listening and they may have questions. So I just want to invite folks to, let us know if there are specific questions that you have for Dr. Mia that, that we haven't answered, or even if it means that we kind of have to go back on something and clarify. So someone said, Sandra just said postmenopause is no joke. So we talked about premenopause and we talked about menopause, but can we talk a little bit about postmenopause?
It's all, to me, it's all the same. It's the same symptoms. You know what I mean? So perimenopause kind of starts with these testosterone symptoms, and then those testosterone symptoms continue if you don't replace your testosterone. Once your ovaries stop making testosterone, estrogen and progesterone, it's not going to start back. So for many women, those symptoms will continue through the rest of their lives, because unless they're replacing their hormones, they're not making anymore. So they're going to still have the symptoms because they're caused by low hormones. And once you're in menopause, you're not going to start back, producing them. So you have to replace them.
Right.
If you want to get rid of those symptoms for many women. And I believe in root cause medicine versus reactive medicine. To me, reactive medicine is what we do in the United States. And so when people start having all of these symptoms, the depression, the not sleeping, the weight gain, they get on 1,000 different medications, when in actuality, all they really need is to replace their testosterone and or their estrogen and progesterone, if those are the causes of those symptoms.
Mm-hmm. So if someone's not a candidate for, let's say, HRT, are there supplements?
There are some supplements that may help with mild symptoms associated with menopause. And for some women, supplements work great. But there is no contraindication for any woman to take testosterone. So even though it's a contraindication for estrogen and progesterone, those women with the history of breast cancer, those women with the history of blood clots cannot take estrogen either. But it's no contraindication for testosterone. For women who don't want to take testosterone, again, increasing your resistance training and your muscle mass, doing your protein, and there are definitely plenty of supplements that work well for hormones, but I won't say that I know of a lot of women who are going through menopause and they're very symptomatic and they only take supplements and their symptoms resolve. I will say that supplements work really well with hormone replacement therapy to help improve the symptoms associated with menopause. And I think in very young women or women with very mild symptoms, supplements are great and they can be used alone. But I think in many women who are having a conversation is because they're having more severe symptoms or moderate symptoms. So for many of those women, the answer is hormone replacement therapy. And again, with plant-based bioidentical testosterone, there is no contraindication. It's kind of like, why wouldn't you do it when it improves your health, improves your heart, and then you feel better, you age better? Because menopause is, if you think about it, perimenopause is when many women get a divorce, when many women change careers, because hormonal imbalance affects a whole lot. It affects relationships. It affects how you deal with your children. It affects how you perform on your job. It affects how you are intimate with your partner. I mean, it affects every aspect of your life. So to me, the effect is so significant that I think the real goal should be to figure out how you can replace your hormones so that you can feel normal, healthy, and you can age well.
Yeah, no, that's great advice. And I think just kind of going back to what we talked about in the beginning is really taking ownership and responsibility for your overall health, every aspect of it. And the more you know, the more powerful you are to be armed and to ask questions, because so many people are suffering. I mean, I remember watching my mom. She passed away at 75, but she was still having hot flashes. And she never even talked about it. Like, we would just see her just kind of all of a sudden be glazed and just like, oh, I'm fine, And I'm thinking to myself, wow, she was really going through it,
Right. And it became her new norm. So,
Her new norm, and it just becomes a thing like, oh, that's just what happens. But I do see that we're getting a few questions in the chat, Dr. Mia. So I'm just going to take a few moments to take a look and see. Someone named Shaman says that she has no libido. I don't know if you want to chime in on that. Might be going back to testosterone, which I think you highlighted very, very strongly. But I just want to give you the floor in case there's something else you want to add to that.
Yeah, so that's what I would say is get a hormone panel. And when I say a hormone panel, it is also to rule out other causes that can, that can be a cause of many of these symptoms. So you want to make sure that, you're paying attention to what your medications are. You want to make sure that you're doing all of those things. But at the end of the day, getting that hormone panel to make sure that your thyroid levels are good, your vitamin levels are good, your hormone levels are good. And when I think of hormone levels, when you're going into menopause or perimenopause, that's when we look at your total testosterone. And there is no real studied number for what a good number of testosterone is for women, because remember, it's the forgotten female hormone anyway. We are just now really starting to focus in on treating testosterone for women. So I think getting the hormone labs, if your testosterone levels are less than 100 and you're having all the symptoms that I described that are associated with low testosterone, which includes decreased libido and what we call anorgasmia, or difficulty having orgasms. Testosterone definitely can help with those symptoms. And remember, the estrogen helps with the vaginal lubrication as well. So a combination.
Thank you. There's another question from Lorica. I hope I'm saying that name correctly. Really asking about a list of supplements she should take, and I'm sure you're going to advise that she probably follows up with her physician. But just anything that you want to just add to that as well?
Yeah, so I would say supplements it's a bunch of different supplements. I actually have a supplement line because I do believe in supplements. I believe that God put pretty much everything we need for medicine on the earth. And I believe that comes through a supplement. And I know that our nutritional status is not as good as it used to be because of the kinds of foods that we eat and the things that they allow in our foods here. So supplementation is going to be key. So there are some supplements that I think everybody should be doing. Is definitely a good omega-3 as you age and mature. That's great for your bone health. That's good for your cholesterol. That's also good for your joints. Vitamin D3. Most people are going to be deficient in vitamin D3, and you need vitamin D3 for your bones. So making sure your vitamin D3 levels are staying above 60 to me is great. Not over 100, but at least above 60. Calcium for your bones as well. I say DIM, which is this long word, but it's spelled capital D, capital I, capital M. That's the, but I think that works well for breast health. And it's so many great supplements out there, so I do highly recommend supplements. There's one called Maca that a lot of people like when you're dealing with hormonal things, and red raspberry and yam. And yam is what we actually make our hormone pellets from. So, that is also a good supplement that may help with some of the hormonal symptoms that a lot of women experience.
Yeah, no, I hope that answers Lorica's question, and I definitely know about maca. We have Saidi who says she's 23 and she's aiming to become a nurse practitioner and was happy to learn a lot today. So thank you so much, Saidi. I think that is wonderful.
Good luck. Good
Yeah.
luck.
There is another question here, and it's from Kim, and she says it's hard to determine if the changes are due to I'm older and I don't have time for a relationship or career path anymore versus perimenopause. And I think that goes back to how do you decipher those things?
So look at those labs. The numbers don't lie. Okay. Now the numbers aren't necessarily the same for everybody, because for me to feel good with testosterone and what works for me, my number may be higher when I check my labs after replacement. But I do think that if you look at the numbers and you see that your total testosterone is less than 100 and you're having those symptoms, you can pretty much bet your whole house that replacing the testosterone will get rid of those symptoms. I am aging and getting older, but I don't feel it. And it's because I replaced my testosterone, because low testosterone gives you all the symptoms associated with aging, the weight gain, the fatigue, the irritability, the nights, all of those things are associated with levels. So I do think that many of the symptoms associated with perimenopause and menopause happen to be those same symptoms associated with aging. But I do think that, treating it makes a big difference. And so you're going to age differently when you balance your hormones, as well as do the nutritional part of it, as well as do the exercise part of it, as well as do the mental health component as well.
Yeah, I think one of my biggest takeaways as we talk is just, advocating to have your physician do some of these labs for you. A lot of times there are assumptions that are already made. I know that, I've spoken to friends who've said their doctor said, well, based on your age and the symptoms that that you shared, we can assume that yes, you're already in menopause, and not really allowing for all of the labs to be done that you're mentioning. So I think there's a real value to that, in making sure that some of these labs are in fact done and that you're asking for it. I do want to touch on one thing, and I know we're getting ready to wrap up, but from the perspective of cholesterol, do you see that a correlation between high cholesterol and menopause or perimenopause as well?
Definitely. And one way that we can decrease cholesterol levels for men and women is with plant-based bioidentical testosterone therapy. It actually decreases LDL. So that's the bad cholesterol. So as you age and mature and your testosterone declines, that's when you start to notice, a little bit more high cholesterol and problems with cholesterol. Besides that genetic component, some people can be normal weight, eat healthy, and do all the things right. But if they have that genetic predisposition, they're going to have high cholesterol even with all of that. But definitely you become more insulin resistant. So you're more likely to get diabetes as you age and mature, which is also the same time that your testosterone levels start to decline, as well as your estrogen declining also affects your insulin resistance.
Dr. Mia, this has been a pleasure. Thank you so much for answering all of these questions. This has been such an engaging conversation. I know I personally learned a lot. I really, really appreciate everything that you offered, whether it's your labs, whether it's definitely taking control of your overall health, including sexual health, and just making sure that women put themselves first. I think all in all, that's what I'm really walking away with. I want to encourage our audience to really focus on our survey. I want to make sure that it is available in the chat. This survey allows for us to collect data to know what Black women are saying collectively about their needs and how to address them. And I just want to, Dr. Mia, if you want to just offer a few words before we close, if there's anything that you just want to leave the audience with, I want to give you the floor to do that.
So I guess what my focus is like living your best life, and to do that definitely requires a healthy lifestyle. I think, but understanding that as we age and mature, it doesn't mean we can't continue to thrive. So, the way I have visualized my life is that my last half will be way better than my first half. And so by doing all of those things for behavior modification and lifestyle changes, if I can add that on top of my, taking the right supplements, doing my hormone balance, I'm just going to live a better life. And the importance of intimacy, and you deserve to have the gift from God. You deserve to experience the gift from God, which is orgasms. It's one of the few things in life that you can enjoy with a partner or without a partner. It's the only thing in life that releases certain endorphins that improve your health and your overall well-being. So understanding that it is important for you to invest the time and the energy into your lifestyle and the way you live, so that you can live your best life. And you're going to do that with the choices that you make, including hormonal balance, including eating healthy, including exercise, including having the right doctors that care enough about you to figure out what's going on and to actually treat it, and to make sure you're doing all of those preventive things that you need to do as well. Because if I give you all the hormones in the world and all the O shots in the world, if you're not doing the basics like eating healthy, maintaining a healthy weight, doing your preventions and screening, it's not going to be worth anything. So advocate for yourself, find doctors that care about you, ask those questions, and understand that it is important for you to invest in your health, because your health is your wealth.
Yes, it is. And on that note, I don't think there's anything else to add. Thank you so much. Have a great evening. I want to thank our audience for joining the virtual Sister Circle, the Black Women's Health Imperative, Power in the Pause. Please complete the survey again, and we thank you and have a great night.
Thank you.